Welcome to Sociology Vibes, where we simplify challenging ideas into easy to understand insights. Today, our focus is on the sociological explanation of the conflict theory on the medical institution. Conflict theory is a macro-analysis theory of how society works. An easy way of understanding this theory is to see it from the lens of social inequality. Conflict sociologists believe the medical institution reproduces societal inequalities because the healthcare system is organized to benefit only some categories of people, specifically reflective of socioeconomic or social class status, race and ethnicity, and even sex and gender. Conflict sociologists ask questions such as, who has power in healthcare? Who gets access? Who profits and who doesn't? When we apply these questions to health, we start to see that not everyone has the same chances at being healthy. The conflict perspective is rooted in the ideas of historian and philosopher Karl Marx, who focused on capitalism as a major force of social inequality in modern societies. Conflict sociologists believe that the social inequalities in society and within the healthcare system consequently affect health outcomes. The United States healthcare system is mainly a profit-driven model. Healthcare in the American society is a commodity, just as any product or service in the capitalist economy. Access to healthcare in the American society is based on the ability to pay for it. And this creates a two-tiered system, with some groups having access to quality health care, while others are denied access to quality health care. Having access to medical insurance does not guarantee access to quality health care, since there are differences in care based on different health insurance coverage, such as Medicaid, Medicare, private insurance, Veterans Administration, and many others. Conflict sociologists ask what happens to patients when health becomes a for-profit service or product instead of a human right. The United States is the #1 spender on healthcare costs, yet it is not the first in positive health outcomes. This results in the vast profitability of the pharmaceutical industry, overprescribing of medications and medical procedures, and authority of healthcare professionals over our lives. Pharmaceutical companies make money from prescriptions. Insurance companies profit from monthly premiums. Private hospitals charge more for better care. Consequently, this contributes to the high cost of medical insurance for both employers and family households, and people living without any medical insurance coverage. The depersonalization of medicine refers to patients being treated as objects due to cost-cutting strategies. Conflict sociologists believe that when the healthcare system is profit-driven, not everyone is served equally, especially those who cannot afford the costs. Social inequality can be measured by examining life expectancy rates, infant mortality rates, and the number of uninsured people in society or access to quality and affordable health care. In the United States, there are observable patterns in terms of health outcomes reflective of race and ethnicity, sex and gender, and socioeconomic status or social class. In the United States, medical sociologists tend to view socioeconomic status as one of the key contributors to health outcomes, including the interconnection between race and ethnicity and social class. One way to think about the influence of social class is to examine the social determinants of health in a particular neighborhood that might influence health outcomes. For example, people living in wealthy neighborhoods have access to hospitals, physicians, fitness gyms, clean air, healthy food, compared to lower income neighborhoods. People living in lower income neighborhoods might lack access to these resources, and instead of grocery stores have an overabundance of fast food, liquor stores, fewer physicians, and longer wait times. These differences illustrate that health and illness is not an individual issue. It is systemic. It is systemic and dependent on the social structure of society. Conflict sociologists help us see that health outcomes are not just random, that they are patterned. Conflict sociologists also study bias, prejudice, and discrimination within the medical institution. People who identify as people of color, women, LGBTQ, often report of being dismissed, ignored, and misdiagnosed, replicating existing social inequalities. The conflict theory on medical institutions helps us recognize that health isn't just about personal choices and behaviors. Rather, it's also about access, systems, and the social structure or organization of a society. This awareness can empower us to ask questions, advocate for social justice, and look at the big picture rather than absorbing self-blame, guilt, or shame. And this makes sociology fascinating, don't you think? Thank you for watching. Be sure to comment below with your thoughts, questions, or any topics you'd like us to explore next. Let's keep the conversation going and our community growing. See you in the next Sociology Vibes video.